in the front of the thigh. Now we are going to discuss about the femoral nerve and its branches. We know that the front of the thigh or anterior compartment is also called as the extensor compartment. All the muscles which are present in the anterior compartment of the thigh are innervated by the branches of the femoral nerve. And if you talk about the femoral nerve is the largest branch of the lumbar plexus. And this femoral nerve is the chief nerve of anterior compartment, or we can say the extensor compartment of the thigh. So in the femoral nerve, we will discuss about its origin, course, distribution, and finally we will discuss about the various branches of the femoral nerve. So let us see the origin of the femoral nerve. So you studied about the lumbar plexus when we discussed about the cutaneous nerves of the lower limb. In the lumbar plexus we discussed about L1, L1, L2, L3, L4, L5. So here in the lumbar plexus we discussed about the anterior division as well as the posterior divisions of the lumbar plexus, right? So the anterior division or the ventral divisions of L2, L3, L4 forms the obturator nerve, and in the same way the dorsal divisions of L2, L3, L4 forms the femoral nerve. So if you talk about the origin of the femoral nerve, it is originated from the lumbar plexus. From what divisions of the lumbar plexus? Dorsal divisions of the lumbar plexus, because the same L2, L3, L4 ventral divisions gives rise to the obturator nerve, and in the same way the same spinal segments L2, L3, L4, that is dorsal divisions, gives rise to femoral nerve. So we can say that the femoral nerve is formed by the dorsal divisions of anterior primary rami, dorsal divisions of anterior primary rami of L2, L3 and L4. So this is the origin of the femoral nerve. So we can say femoral nerve is the largest branch of the lumbar plexus. It is formed by the dorsal divisions of the anterior primary rami of spinal nerves L2, L3 and L4. Okay. So here you can see after the formation of the femoral nerve, the nerve runs behind the inguinal ligament to enter into the femoral triangle. Remember, in the femoral triangle we discussed that the femoral nerve is lateral to the femoral artery, and also we studied that the femoral nerve is located out of the femoral sheath, or the femoral artery as well as femoral nerve are divided by the femoral sheath in the upper part of the femoral triangle, right? So here the femoral nerve enters into the anterior compartment of the thigh or front of the thigh by passing behind the inguinal ligament, that is lateral to the femoral artery. So here I will mention this is the femoral artery, and lateral to the femoral artery we can see the femoral nerve in the femoral triangle. So by this we can say the course of the femoral nerve, it enters the femoral triangle by passing behind the inguinal ligament just lateral to the femoral artery. And also I told you about the presence of the femoral nerve in the femoral triangle, that it is situated in the groove between the iliacus as well as psoas major, right? Where it is exactly seen at the femoral triangle, it is seen in the groove between the iliacus and psoas major, outside the femoral sheath, that is lateral to the femoral artery, right? So by this we came to know that how the femoral nerve enters into the anterior compartment of the thigh. It is also called as the extensor compartment, right? Now, by the time the nerve reaches 2 centimeters below the inguinal ligament, so here I will mention, by the time it reaches 2 centimeters below the inguinal ligament, the nerve divides into anterior division as well as posterior division. So here I will write anterior division as well as posterior divisions, where it is by the time the nerve reaches 2 centimeters below the inguinal ligament, it is divided into anterior divisions as well as posterior divisions. So this is the origin as well as the course of the femoral nerve. So now, as I told you that it is divided into the anterior division as well as posterior division, the anterior as well as the posterior divisions of the femoral nerve are separated by the lateral circumflex femoral artery. So here I will just draw the lateral circumflex femoral artery. So here we can see the lateral circumflex femoral artery separates the posterior division with the anterior division of the femoral nerve. You know that the lateral circumflex femoral artery is a branch of profunda femoris artery, and profunda femoris artery, you know that it is the largest branch of the femoral artery, right? So the lateral circumflex femoral artery, here I will draw the lateral circumflex femoral artery. This is, let us assume that this is the lateral circumflex femoral artery, separates the anterior as well as posterior divisions of the femoral nerve. Now, after we discussed about the origin as well as the course of the femoral nerve, now we shall discuss about the branches of the femoral nerve, or we can say the distribution of the femoral nerve. The femoral nerve has various branches, like it has the muscular branches, it has cutaneous branches, it has articular branches, as well as it has the vascular branches. Okay, so now we shall discuss one by one in detail. First, let us discuss about the muscular branches of the femoral nerve. Okay, so now I am going to explain you about the muscular branches of the femoral nerve. First is muscular branches. So remember, we know that we have the anterior division as well as posterior division, right? Anterior division as well as posterior division. Here you can see the orange one is the anterior division and the yellow one is the posterior division. So you can see the anterior division is giving one muscular division or one muscular branch. The anterior division of the femoral nerve gives one muscular branch. It is the nerve to sartorius. So the anterior division gives rise to sartorius. Anterior division gives rise to sartorius. Okay. So I will give the numbering here. By that you can understand what is the division and what is the branch which is supplying to the respective muscles. Now the anterior division of the femoral nerve gives a muscular branch to the sartorius. Now posterior division, I will start from 2 here. Posterior division gives muscular branch to the first one. This is the posterior division. The posterior division gives to the branch to the rectus femoris. So second one is rectus femoris. Posterior division gives to the muscular branch called as rectus femoris. After rectus femoris, the third one, it gives innervation to the 3 vasti muscles. So vasti. So in the vasti, you know that we have 3 vasti muscles: vastus lateralis, vastus intermedius, vastus medialis, right? So like that, the posterior division of the femoral nerve has three separate nerves to the three separate muscles. One is, here you can see, I will give it as A, B as well as C. Okay, so here I will mention as a 3A, 3B as well as 3C so that you can understand very easily. So this is the lateral most nerve you can see. So here I will mention it is called as 3A, which means it is the vastus lateralis, right? This is the lateral most and it is the vastus lateralis. After vastus lateralis, the middle one is called as 3B, right? So it is called as the vastus intermedius. So this is called as the vastus intermedius, right? And afterwards you can see the medial one. You can see the medial one, that is, I will mention it as a 3C here. This is the medial one. It is called as 3C, that is vastus medialis. So the posterior division of the femoral nerve gives off muscular branches to the rectus femoris, vastus lateralis, vastus intermedius, vastus medialis. Okay, so these are the important muscular branches. And also another important point I want to tell you that the nerve to the vastus intermedius gives innervation to the another muscle called as articularis genu. So another muscle, articularis genu. So the muscle articularis genu is innervated by the nerve to vastus intermedius. So these are the muscular branches innervated by the anterior as well as the posterior divisions of the femoral nerve. What it is? We can have a quick review. The anterior division supplies the sartorius, the posterior division supplies the rectus femoris, 3 vasti, and the articularis genu. At last I told you that the articularis genu is supplied by the branch from the vastus intermedius. Now, after we discussed about the muscular branches, now let us see what are the cutaneous branches innervated by the femoral nerve. Now let us see the cutaneous branches. Okay, cutaneous branches. Again, in the cutaneous branches we have the anterior division as well as posterior division, right? Anterior division gives off 2 cutaneous branches and the posterior division gives off only 1 cutaneous branch. The cutaneous branches which are supplied by the anterior division, one is to the intermediate as well as the medial cutaneous nerves of the thigh. What are they? Intermediate as well as medial cutaneous nerves of the thigh. So here the first one, this is called as the intermediate cutaneous nerve of the thigh, and second one, this is the medial cutaneous nerve of the thigh. So the anterior division, you can see the orange one is called as the anterior division. Anterior division is giving 1 muscular branch called as sartorius and 2 cutaneous branches. So here I will write cutaneous. So cutaneous. Okay. So 2 cutaneous branches. One is on the intermediate side, because you know that another nerve which is present over here is called as the lateral cutaneous nerve of the thigh, right? So this is the lateral cutaneous nerve of the thigh, and this is the intermediate cutaneous nerve of the thigh, and this is the medial cutaneous nerve of the thigh, right? So here the intermediate cutaneous nerve of the thigh, this is the intermediate cutaneous nerve of the thigh, as well as the medial cutaneous nerve of the thigh. Medial cutaneous nerve of the thigh are the cutaneous divisions given by the anterior divisions of the femoral nerve, right? Now coming back towards the posterior division, so the yellow one is called as the posterior division. In the posterior division you discussed already about muscular branches. What are the muscular branches given off by the posterior division? Let us have a quick review. This is called as the nerve to rectus femoris. This is called as the nerve to vastus lateralis. This is the nerve to vastus intermedius. This is the nerve to vastus medialis, and the only nerve which is left over is called as the cutaneous nerve, right? So this is the cutaneous nerve given by given off by the posterior division of the femoral nerve. This is the saphenous nerve. Okay, this is the saphenous nerve. So the posterior division gives off a cutaneous nerve called as the saphenous nerve. So totally there are three cutaneous branches. That is, the anterior division gives two cutaneous branches. That is the intermediate and the medial cutaneous nerve of the thigh. And the posterior division gives off only one cutaneous branch. That is the saphenous nerve. Right. So these nerves we already described earlier when we discussed about the cutaneous nerves of the lower limb. So by this we finished what are the branches given off by the femoral nerve. First one is muscular branches, second one is the cutaneous branches. Now let us see what are the articular branches of the femoral nerve. Articular branches of the femoral nerve. So now articular branches. Articular branches. So first one, second one. There are two articular branches. One is given to the hip joint and second one is given to the knee joint. So there are two articular branches. One is to the hip joint and one is to the knee joint. Here you can see which nerve is closely related to the hip joint here. Which nerve is closely related to the hip joint? This is the nerve to rectus femoris, right? So a articular branch which arises from the nerve to rectus femoris supplies the hip joint. So hip joint is supplied by the nerve to rectus femoris. Hip joint is supplied by the nerve to rectus femoris. And which nerve is closely related to the knee joint here? Which nerve is closely related to the knee joint? So saphenous nerve, even though it is related to the knee joint, but it is a cutaneous nerve, right? It is not an articular branch. So here you can see the medial cutaneous nerve of the thigh, right? This is the not medial cutaneous nerve, it is the nerve to vastus medialis. So this is the nerve to vastus lateralis, vastus intermedius, and this is the nerve to vastus medialis. So the nerve to vastus medialis gives innervation, means it gives off an articular branch to supply the knee joint, right? So knee joint is innervated by the nerve to vastus medialis. So there are totally how many muscular branches are there? Anterior division of the femoral nerve gives off one muscular branch, that is sartorius. Posterior division of the femoral nerve gives off muscular branches to the rectus femoris, three vasti, as well as articularis genu. The articularis genu is actually innervated by the nerve to vastus intermedius. And coming towards the cutaneous branches of the femoral nerve, the anterior division gives off two cutaneous nerves, that is the intermedius cutaneous nerve of the thigh and another one is the medial cutaneous nerve of the thigh. And the posterior division of the femoral nerve gives off one cutaneous branch called as saphenous nerve. And coming towards the articular branches are given off to the hip joint as well as knee joint. A nerve to rectus femoris gives off an articular branch to the hip joint, and the nerve to the vastus medialis gives off articular branch to the knee joint. So by this we studied about the muscular branches, cutaneous branches as well as articular branches, and at last we are going to discuss about the vascular branches. In the vascular branches, an important branch is given to the femoral artery as well as its branches. So before I finish off the branches, I want to talk about Hilton's law here. Whenever a nerve supplies to the muscle which lies across a joint, it not only supplies the muscle but also supplies the joint beneath and also the skin overlying the muscle. So what does it mean? So whenever you see any branch or any nerve which is supplying a muscle, if that muscle runs over any joint, that nerve not only supplies the muscle, it also supplies the joint underneath it, and also it also gives innervation to the skin overlying it. This is called as the Hilton's law. So by this we finished about the origin, course and various branches of the femoral nerve.